Healthcare coverage in jeopardy for hundreds of thousands of people in Missouri.
Missouri senators blocking funding for a voter-approved initiative that would expand Medicaid eligibility. News 4's Jenna Ray is watching out for you to find out what this really means for you. Jenna?
Sam and Corey, simply put, the original amendment Missouri residents voted on back in August did not include funding. Voters said, yes, we want to make sure that more Missourians who are under the poverty line are eligible for Medicaid. This means if you're a family of four that brings in less than $37,000 a year, you could qualify for government-funded health care. However, lawmakers say they don't want to foot the bill, and now Missourians are worried they could lose coverage that they already have.
My daughter was born totally disabled. She has several medical issues that have rendered her, she's unable to sit up on her own, unable to stand, walk, speak. She can't even eat by mouth like average people can.
For the last 13 years, Erin Bross and her daughter Serena have qualified for Medicaid. Bross is her primary caregiver.
She is on multiple pieces of medical equipment to live. With her not having Medicaid, she dies just from lack of equipment.
Bross says she's had Medicaid taken away before, and this amendment expanding the service would have guaranteed her coverage moving forward. In August, voters approved this expansion. On Wednesday, Missouri lawmakers voted against funding it.
My opposition to expanding any expansion of Medicaid is because right now that's probably one of our worst run programs that we have in the state.
Senator Bill Eigel of St. Charles says he wants to see reform in Medicaid before agreeing to put more money into the system.
Every reasonable person, Republican or Democrat, wants to take care of the most vulnerable that we have in our population. And if we expand a program now that is as broken as Medicaid is, that program may not be there at all in 10 years. And that's going to hurt a lot more people than the folks we're already serving today.
Eigel says he's filed several pieces of legislation to reform Medicaid. Specifically, he says he wants to put a stop to Missouri hospitals paying for out-of-state patients. According to Kaiser Health News, as of 2019, 15% of Missourians are covered by Medicaid. As of now, that number won't increase unless funding from the legislature is approved.
Having to worry about, is she going to wake up tomorrow? And then trying to worry about, well, will I have insurance tomorrow? Will I not?
I talked with Empower Missouri today, one of the largest poverty organizations in the state. The director tells me folks who are already on Medicaid shouldn't have it taken away. Sam.
And Jenna, voters want it funded. Lawmakers don't want to pay for it. So what happens next with this? And for the people who voted for it, what does it say about their vote and how that matters?
So the General Assembly will pass their 2021-2022 fiscal budget as is. It then gets sent to Governor Parsons' office. He could add this expansion into the budget. However, if that's not added, the amendment that voters approved back in August basically doesn't exist.
And there could be court cases to follow this as well. What should we expect on that front, Jenna?
Sam, an outside group could sue the state of Missouri over constitutional violations. News 4 actually sat down with Attorney General Eric Schmidt, talked to him about this today. He says it's possible to see some litigation. He also says with a few weeks left in the legislative session, things could change.
All right, things still developing there, Jenna. Thank you.